Hi, my name is Ari, and for my video oral, I will be talking about the controversial subject of the fashion industry's view on anorexia and bulimia. How are anorexia and bulimia socially accepted in our society today? So, my oral will be divided in these terms. So, first, I will be explaining what exactly anorexia and bulimia is and the DSM 5 explanation for these terms and the criteria. And then I will be talking. So, what exactly is anorexia? So, the National Institute of Mental Health describes anorexia as an eating disorder characterized by low weight, fear of gaining weight, and a strong desire to be thin, resulting in food restriction. Anorexia is more common in women, and it affects 0.9% of American women. People with anorexia generally have a false view of their body weight and thrive to look as thin as possible, even if this means that they are unhealthy. They don't actually see how unhealthy they're being, they just want to be thinner than they are. They don't actually have a goal either. So this goal could end up being death or hospitalization. So people with anorexia rationalize their disorder with a sense of control that they don't have in their everyday life. So for bulimia, Women's Health describes bulimia as an eating disorder characterized by binge eating and then followed by purging. So binge eating in this context refers to eating a large amount of food in a short amount of time. And then purging would be attempts to get rid of the food. So bulimia nervosa, or simply bulimia, affects 1.5% of American women. So it is more common than anorexia. People who suffer from bulimia tend to be of average weight, so they are not extremely thin or extremely obese. And they rationalize eating a lot with being able to purge it all out, which is there that they find their sense of control because, like anorexia, bulimia has a lot to do with finding a sense of control in their life. So, the DSM 5 criteria for anorexia has 3 points. So, to be diagnosed with having anorexia, a person must display one, persistent restriction of energy intake leading to significantly low body weight. And this has to take in context the fact of how old they are and the gender they are and their physical health. So a 12-year-old that weighs 85 pounds is not the same as a 22-year-old that weighs 85 pounds. Secondly, a person must display either an intense fear of gaining weight or of becoming fat, or persistent behavior that interferes with gain weight. And thirdly, a person has to display disturbance in the way one's body weight or shape is experienced, undue influence of body shape and weight on self-evaluation, or persistent lack of recognition of the seriousness of the current low body weight. So for bulimia, the DSM 5 has 5 points. So to be diagnosed with bulimia, a person has to have recurring episodes of binge eating. And binge eating is eating a lot of food in around a 2 hour period. And this food has to be like of very large proportions, usually a lot bigger than a normal person would eat. And there is a sense of lack of control, so a person feels as if they cannot stop eating. The second thing is person has to have recurring inappropriate behavior to compensate for the weight gain. So they could be self-inducing vomiting, using laxative, diuretics, or other medication, fasting, or doing excessive exercise. The third thing is the binge eating itself and the inappropriate behaviors. have to both occur on average at least once a week for 3 months. The fourth thing is self-evaluation is influenced by body shape and weight. And the fifth thing is the disturbance does not occur exclusively during episodes of anorexia. So my thesis statement is, what is the fashion industry's position on extreme thinness, and whether or not society has in some way accepted eating disorders. So anorexia and bulimia in society. I will start off by a quote. So media exposure to thin beauty ideals has been shown to have a negative influence on body satisfaction, mood, and self-esteem in women. This was taken from short-term effects of media exposure to the thin ideal in female inpatients with an eating disorder compared to female inpatients with a mood or anxiety disorder, or women with no psychiatric disorder. Academic journal that I've used for one of my sources. So society has a very conflicted view on anorexia and bulimia. The fashion industry thrives for very thin models, but doesn't want to portray or in some way support eating disorders. Also, actors are supposed to look perfect to please the viewers, and young girls often associate Hollywood perfection with acceptable beauty standards. This would mean that from a very young age, young girls have a view of what they think is the perfect body type or the accepted body type. And in most cases, it's somewhat unhealthy, and some girls will do anything to get that body. So another quote in the changing shape of female fashion models study, they concluded that the shape of the cohorts of fashion models studied had altered in a number of respects. The models had become taller, and although their waist size had increased, there was no corresponding increase in hip measurement. Thus, bust and hip size decreased relative waist size, producing a more tubular shape. The constant challenge and stress that people put on their bodies for their so-called beauty standards is becoming more and more unhealthy. It becomes an obsession, which could lead to having either anorexia or bulimia. This is where the change goes from an unhealthy diet to an eating disorder. It's the fact that some people will literally stop at nothing to reach society's unhealthy and unrealistic beauty standards. In the article Hunger Hurts But Starving Works, Gisela Orsini discovered this about anorexia from her participants in her study. Becoming anorexic is considered by them to be a difficult process that requires the adoption of specific behaviors towards food. It requires a constant focus on the achievement of a target body weight. Each single action, movement, and interaction is performed in order to lose weight. Every single moment of the day is meticulously planned, and nothing is left to chance. So to conclude, I will be discussing a shared consensus that I found in all three articles. So in all three articles, it seems that although probably not done on purpose, society has a way of encouraging young girls to starve themselves in order to be thin. It is deemed a standard to look a certain way, and trying to look this way can put strains on a person's body and, of course, mind. While the role of media exposure to the thin ideal as a risk factor for the development of eating disorders is thus well understood, they are to the best of our knowledge, no studies available to date that investigated the effects of exposure to the thin beauty ideal on recognition and emotion in patients suffering from eating disorders or other mental disorders.